Hey there, welcome back. In today's video, we are going to talk all about mental health partial hospitalization programs, or PHPs. I'm going to tell you what exactly a PHP is and what happens during the day. I'm going to talk about groups, therapy, medication management, insurance, and how to decide if a PHP is right for you. Welcome back. If you're new here, my name is Ramsey Dean, and I'm a licensed therapist, and I am actually the manager at a partial hospitalization program. Before we get into the material, please subscribe to the channel if you're interested in mental health topics. So a partial hospitalization program, or PHP, is a type of intensive mental health treatment designed to provide rapid stabilization for people who are at risk of needing to be admitted to a psychiatric hospital. Later in the video, I'm going to explain how to determine if a partial hospitalization program is right for you. So stay tuned for that information. But the way a PHP works is you go to the treatment center for a big chunk of the day, usually about 6 to 8 hours, and then go home in the evenings as opposed to sleeping in the hospital overnight. PHP hours can vary from program to program, but usually they resemble school hours. The program I work at runs from 8:30 in the morning until 2:15 in the afternoon. The average length of stay in a PHP is about 2 to 3 weeks. So it is a pretty big time commitment. You are going to need to be able to take time off of work or school in order to complete the program. A lot of times the patients I work with will use FMLA or short-term disability in order to get the time off from work approved. In a partial hospitalization program, the main thing is group therapy. You'll be spending most of your day in these groups. Before you decide group therapy isn't for you and rule out the idea of joining a program like this, let me explain a bit more about what these groups are like. In a partial hospitalization program, many of the sessions are like classes. It's not just sitting around talking about problems all day. While support groups can be helpful, that's not the main focus here. These groups are meant to teach you practical skills that you can start using in your daily life right away. You'll learn things like mindfulness, how to handle stress better, manage your emotions, deal with anger, stop negative thoughts, break the cycle of anxiety and depression, and set healthy boundaries. There's a lot more to it, but those are some examples. Most programs use cognitive behavioral therapy, or CBT, and dialectical behavior therapy, or DBT. If you don't know what those are, I've explained them in videos linked below. In simple terms, they help you change the way you think and behave to feel better. These therapies work well in groups and can bring relief pretty quickly, which is why they're common in partial hospitalization programs. The goal of these groups is to give you a bunch of tools as quickly as possible so you can get your mental health in check and go back to your normal life. Many people who go for a partial hospital treatment have trouble doing their regular activities because of their mental health. Maybe your hygiene is suffering, you're not eating enough, your sleep is bad, work or school is hard, relationships are strained, or decision-making and concentration are a struggle. These groups aim to help you get back on track in a safe and supportive environment. Besides learning skills and dealing with daily challenges, some groups are more about support. You get a chance to talk about your problems and feelings with people who understand and won't judge you. Some groups might also involve activities like meditation, breathing exercises, art or music therapy. It's a mix of things designed to help you in different ways based on what you need. In addition to the group sessions, partial hospitalization programs also include a medication management aspect. In the first or second day of the program, you'll meet with the psychiatric provider, often a psychiatrist or psychiatric nurse practitioner, who has the authority to prescribe psychiatric medication. They'll discuss your situation, suggest starting new medications, or adjusting your current ones to stabilize you quickly. If you both agree on the medications, the prescriptions will be sent to your pharmacy. You can pick up the medications in the afternoon and take them at home. Unlike a hospital, you won't receive medications daily at the program. You're responsible for managing them at home. A registered nurse is available every day for questions, and the psychiatrist will see you once a week, making changes as needed. The medication evaluation in a partial hospitalization program offers two significant benefits. First, it can be challenging to find a psychiatrist who can see you quickly. Waiting for weeks or months while struggling is not ideal. A PHP can quickly assess your medication needs and start you on the necessary medications. Second, a PHP psychiatrist can make medication changes faster than a regular outpatient psychiatrist. Daily assessments in the program provide more clinical information, speeding up the process compared to traditional outpatient settings where adjustments may take longer. Having quick access to a psychiatrist is something that makes PHPs unique, and it's invaluable if you need a medication evaluation fast. During your time in the partial hospitalization program, you'll receive individual therapy approximately once a week. Most PHPs have a licensed social worker, mental health counselor, or another master's level clinician who will guide you through the program. However, it's crucial to set realistic expectations about what individual therapy looks like in a PHP. The individual treatment provided is brief, short-term, and focused on practical solutions. The sessions will revolve around assessing your progress on goals, your ability to apply the skills learned in group sessions to your daily life, and identifying and problem-solving any barriers you may be facing. Unlike traditional therapy that delves into childhood or past trauma, the aim here is to avoid opening an emotional Pandora's box only to part ways in a few weeks, which can be more harmful than beneficial. While in the PHP, a clinician will collaborate with you on developing an aftercare plan. If you don't already have a therapist, they can offer you a referral so that once you feel stable, you can transition to more in-depth, meaningful work with a long-term therapist. I often compare attending a PHP to being admitted to a hospital for a broken leg. The program helps stabilize you and get you back on your feet, but the ongoing recovery and healing journey continue after leaving the PHP. Regarding individual therapy, some patients prefer to continue seeing their existing therapist while in the PHP. While this is possible, it's important to note that certain insurance companies may not cover it, citing concerns of double billing. It's important to discuss this with your therapist and reach out to your insurance company to ensure you won't face unexpected charges. When deciding whether a partial hospital program is the right fit for you, there are a few things to consider. First and foremost, ensure that your needs don't require a higher level of care, meaning you don't need immediate hospitalization. If you have any plans or intentions to end your life, that is a crisis that needs immediate treatment. You can go to your nearest emergency room or call the National Crisis Hotline if you are unsafe and need assistance. In the United States, you can dial 988. Similarly, conditions like psychosis involving hearing voices or having visual hallucinations may require stabilization in an overnight hospital setting. If you're struggling with chemical dependency, particularly if you're unable to cut back your drug or alcohol use or are concerned about withdrawal symptoms, it might warrant a medical evaluation and a different level of care, such as a rehab program. Substance use treatment policies vary among PHPs. Some exclusively focus on mental health, while others specialize in and design their entire program around addiction treatment. Some programs offer co-occurring treatment, addressing both mental health and addiction needs. If you are unsure about this, reach out to the admissions department of the PHP you're considering for clarification. Another vital factor to consider is your willingness to engage in group treatment. While I encourage you to approach group therapy with an open mind, it's understandable if it's not for everyone. If you have conditions like agoraphobia or severe social anxiety, you may find the constant group setting overwhelming. In such cases, starting with individual counseling to learn skills one-on-one may be a better approach. Lastly, evaluate whether you genuinely require intensive treatment. An ideal PHP candidate benefits from the structure of psychiatric hospitalization, but is safe and stable enough to return home in the evenings. Functional impairment, such as difficulty completing daily routines, struggles in self-care or work, strained relationships, changes in sleeping or eating patterns, social withdrawal, or an overwhelming need for help indicates that a PHP might be appropriate for you. If you're thinking, I want help, but my struggles aren't that severe, regular therapy and consulting with your primary care physician for potential medications might be more appropriate. That doesn't mean your issues are not serious, it just means you might be able to get your needs met with a lower level of care. Also, your insurance company will require evidence of the necessity for intensive care, and not meeting PHP criteria might result in refusal to pay, potentially leading you to getting a large unexpected bill. Let's delve deeper into the topic of insurance coverage for partial hospitalization programs. In my experience, insurance companies generally cover the cost, but there are important details to consider. First, find out if the program is in network with your insurance provider. Being in network means that the program has a contractual agreement with the insurance company. If the program is out of network, don't worry. You can still explore coverage options with a bit of research. Conduct a Google search to identify other partial hospitalization programs within a 35 to 45-minute radius of your house. Contact these programs to verify their network status with your insurance company. If you find an in-network program within a reasonable drive, it's advisable to choose that program to avoid potential billing issues. In the event that there are no suitable in-network programs nearby, you may still be able to secure coverage for your preferred program even if it's out of network. To do this, approach the admissions department of the chosen program and inquire about a single case agreement or an out-of-network exception with your insurance company. Essentially, this involves a one-time special agreement where the insurance company agrees to cover the cost of your treatment at the chosen program. While this process might seem complicated, it is a routine practice, and many programs successfully navigate this. If the program hesitates to initiate the process, but you are determined to attend, you can take matters into your own hands. Reach out to your insurance company directly and discuss the possibility of a single case agreement or out-of-network exception. If you meet the criteria for a partial hospitalization program due to the risk of hospitalization, most insurance companies are willing to work with you to ensure you receive the necessary care. Beyond checking in network status, it's crucial to examine your insurance policy for a deductible, as this may entail out-of-pocket costs during your stay in the partial hospitalization program. My biggest advice if you're starting a PHP is to go in with an open mind. I am not going to lie to you, some of the skills training you're going to receive in group will feel cheesy at times. If you can put your ego to the side and give the skills a chance, you might be surprised at what actually works for you. My next piece of advice is to manage your expectations. Not every single group is going to resonate with you, and that's okay. If you take one thing away from each day and apply it at home, that is a win. Lastly, be kind to yourself. Joining a PHP is a big deal. Give yourself credit for that. In the beginning, don't worry about trying to remember all the skills perfectly or performing at your best. Just allow yourself space to simply show up and just get through the day. Lastly, be patient. It might take you a few days or even a week before you settle in and feel comfortable in a PHP. Try not to throw in the towel or make any hasty decisions in the first couple of days. Give the treatment a fair chance to work. Thank you so much for watching. Let me know your thoughts in the comments down below. I'd love to start a discussion and answer any of your questions. See you next time. Bye-bye.